Okay, everybody, let's talk about the bones of the head, neck, and face. It's actually kind of a fascinating area of the body, and we really debated where to put this in your curriculum. You would think we would start with head, or we would have head in sooner. People have headaches. They're going to come to you with head problems. And so it's funny we didn't put it in sooner. But if you are architectural massage therapists, which I believe you are, and you're building a building, you end with things like the head and such, which is why we kind of did things the way we did them. Is we made sure we really focused on the foundation, because what we found out there was a lot of massage therapists actually kind of knew head and shoulders a little bit. They didn't know anything else. Anyway, we will be discussing muscles of the head and face, but I want to be very clear. We separate them into two categories. We will very briefly go over facial muscles, because we'd love for you to have heard about them, but they are not structural muscles. You do not need to know all the names of the facial muscles, and there are a lot of them. So you will review how people do what I am doing with my face with all these different muscles. But that will not be something we spend a lot of time on. I don't think it'll help your career, all that kind of stuff. We would just want you to be aware that there are non-structural muscles in the face. But we'll also be paying very close attention to structural muscles in your face. Things like your temporalis, your masseter, your pterygoids, things that we think are very sternocleidomastoids, mastoids, scalenes, all this stuff that we think is actually very important to headache relief and brachial plexi problems and all that kind of stuff. And I think you can tell from that opening assignment that's kind of where we're headed with that. So let me present now. And you should see a gentleman having rope for lunch. Do we see that? Good. Yeah, he's hungry. That's, a lot of fiber in rope. So that's good. Okay. Deli. Okay, so I'm actually going to skip over this part here. All right, so the good news is some of this stuff will make sense to you, because some of it will just make sense to you because we've mentioned it before. But it is important to know the major bones of the head. And remember, these bones, most of them are held together by little sutures. Remember? And these are those joints that are essentially immovable joints. You probably don't remember what that's called, but that's called synarthrosis. These are joints without movement. That is not entirely true. Just to let you know, your head is meant to have flex. The reason you have all these sutures that tie your bones together is to give your head a little bit of flex, because if it doesn't flex, it can break. But in the true sense of like a synovial joint, there's no movement here. These are not synovial joints. These are fibrous joints where your head is really sewn together by like cartilaginous fiber, so it's got a little bit of flex, but they're not coming apart. Okay, so your forehead on the front of your face is your frontal bone. This really is your frontal bone. The side of your head are parietal bones. We're going to see this from several angles. You do have temporal bones right by your temples. And then there is a very tricky bone to visualize. So do you guys see up there on the right hand side it says sphenoid bone, S-P-H-E-N whatever, E-N-O-I-D, sphenoid. And it kind of shows it to you. It's like, oh, it's this little bone here. It's actually probably one of the most important bones in your entire skull, because it ties everything together. And let me show you what I mean by that. Here, if you look at me and not the slideshow for just a second, is the skull. Okay? And this, by the way, the blue is your frontal bone, right? And the green here is your parietal bones on the side. And this yellow really is your temporal bone. Well, that red right there, that's your sphenoid bone. That red right there, that's the same sphenoid bone. That red back in there, that's the same sphenoid bone. Let's take the top of this head off and look inside. The sphenoid bone is this bat-shaped bone. A lot of people describe it that way. Bat-shaped bone that actually goes from one side of your head to the other and underneath, and your brain actually rests on top of it. And if you open up your mouth, Oh, and you look inside your jaw, there's the sphenoid bone up the top, making up the top of part of the kind of the roof of your mouth, way in back though. So this bone is kind of like the key bone that all the other bones link into. Sphenoid bone. It's very, very important for that reason. And it's one of the reasons we believe that if you kind of put pressure on one bone, it can kind of pull on all of them, right? This is a very, very important little area, right? And if pressure gets built up in your head, we all know that at least at the bare minimum creates headaches. Okay. Then right here, down here, there's no bone. In the tip of my nose, my beautiful nose here, there is no bone, that's cartilage. But if you go up top here, where I see Miss Hansen rubbing, thank you, Miss Hansen, that is your nasal bone. That is your nasal bone. And if you go down into your eye from here a little bit, it's your lacrimal. There's a tiny little bone in there called your lacrimal. And if you go back even further, you probably shouldn't be touching this on clients, but even further, you'll have your ethmoid bone, which is another little tiny bone back in there. Then we see the face plate here, the mask of your face right here, and that's called the maxilla. And remember, the maxilla kind of is the start of your cheekbones. You've got your maxilla here in yellow. Hold on, my face is falling apart here. Come on, guy. You can do it. There we go. You can see the maxilla in yellow. Well, this is the zygomatic. And the zygomatic meets the zygomatic process of your temporal bone to make your cheekbone. So this kind of eye socket turns into your cheekbone by the maxilla going into zygomatic, going into temporal bone. All this is very important because if you get tension in your temporal bone, it can pull on here, cause tension, those headaches you get in your eyes, things like that. All this kind of ties together, and there's lots of sinuses in this area as well. And of course, last but not least, the mandible jawbone. Yes. All right, moving right along. By the way, do you guys see the tiny holes down in the jaw in your picture right here? Yeah, they're called mental foramen, and they're actual holes in your jaw for nerves to come out through to feed your face. The holes are there on purpose. In martial arts classes, they teach you to hit people right here because if you hit their jaw, that's already devastating, but if you hit the nerve outlet right on their jaw, that's even more devastating. So just a little side note there, just kind of interesting. But those holes are there on purpose to get nerves from inside your body, outside your body, to take care of like some of your facial stuff. Kind of cool. Now we're looking at the back of the face. The back of the skull. Back of the whole thing. And they've labeled some of the sutures where the bones come together. And one of these should be obvious. There is a suture going straight between your parietal bones on both sides, and that suture is dividing me from side to side. So what do they call that suture that meets my two parietal bones but divides me from side to side? Thank you, Ms. Hansen, it is. It is the sagittal suture, yes. And then in back, the two parietal bones come and they meet the occipital bone, the occiput. And right there where they meet there, that's called the lambdoid suture, lambdoid suture. And they meet the occipital bone. And I think, from a massage therapist point of view, the three most important bones in the body, in the head to me, are the temporal bones, because they have all those features that attach to your ears and your eyes, and even your hyoid bone later we're going to find out, and your longissimus in back, and your sternocleidomastoid. So the temporal bone, super, super important from relieving people of pressure and stress. And that's two. And the third one is your occiput. Your occiput or your occipital region or your occiput, all that stuff is super duper important because, as we know, lots of muscles attach to the occiput. we normally talk about them attaching to the superior nuchal line or inferior nuchal line or external occipital protuberance, but all of those are on the occiput. Yeah? So can you name me a muscle that attaches to the occiput? I don't care whether it's origin or insertion, I don't care, but name a muscle that attaches to the occiput. Anybody?
Is it the trapezius?
Trapezius. Thank you, Mr. Tate. Thank you for paying attention. He's 100% right. Trapezius is a great, accurate guess. Miss Felix Osuna, yes.
The suboccipitals?
Yes, thank you. The suboccipitals. Not, by the way, not all of them, because there's a weird one that attaches C1 to C2, but that's a great answer. I would have said the exact same thing. Suboccipitals. Yeah, yes, Miss Hanson.
The longissimus?
The no. The longissimus actually attaches to the mastoid process of the temporal bone.
Okay.
Yeah, does it also attach to the, I think that's it. I don't think it does attach to the, can somebody look that up really quick? I know Miss Hanson, I know it attaches to the mastoid process, but my question is, does it squeak over and also get the occiput? And I think maybe you're right and I'm wrong. Which is, it's nice actually. Let's see. Hold on, everybody, I'm actually looking this up. Longissimus, here it is. Yeah, no, it does not. It is just the mastoid process, from what I'm seeing. So, you were close, though. Close, but no cigar. So we got trapezius, suboccipitals, anything else that attaches to the occiput. Anything on the occiput. Anybody? Okay, I'll call on people then. Miss Torres.
Oh my God, I knew you were gonna call me.
Yeah, can you give me another muscle? Come on.
Another muscle, the levator scapula?
Does the levator scapula attach to the superior angle of the scapula?
Yes.
Yes, and then where does it go to?
Your head.
It actually goes to your neck, to the transverse processes of C1 through C4. Good guess, but wrong. Miss Hunter, you had your Miss Hunter, you had your hand raised?
Yeah, I was gonna say the same thing, but you just said it wrong, so.
Alright, okay. Okay.
How about the ligament nuchae thing? Is that a muscle?
It's not a muscle, but you are 100% correct that the ligamentum nuchae hooks onto the external occipital protuberance of the occiput, and it is at least an attachment. That is a very good start. We'll take ligamentum nuchae even though it's a ligament.
Okay, now pick somebody else.
Thank you, Miss Torres. Miss Harper.
I guess semispinalis capitis.
Thank you, Miss Harper. The speed bumps of your neck, the semispinalis capitis also hooks to here. Yeah, that's pretty important stuff. Cool. Okay. Mr. Tate, you have your hand raised. Do you have another one?
I have two guys. They're both gases, but I was going to say the sternocleidomastoid.
Sternocleidomastoid. That attaches to the mastoid process. It's close, but it's not accurate. It's not right.
Okay, then my second one was going to be the spinalis. No, is that right? Yeah.
Yeah, spinalis doesn't go all the way up there either. Sorry.
Okay.
It's close though, and you're in the right area. You're guessing for the right reasons. Yeah.
Okay. I got one right.
Dude, you're doing great. You're doing great. We're totally happy. Let me see. Mr. Kandaris, sir.
Yes.
Sir, can you think of any muscles that attach to the superior nuchal line, the inferior nuchal line, the external occipital protuberance, anywhere on the occiput, anywhere in the back of the head? So far we got trapezius, suboccipitals, and ligamentum nuchae, which is not a muscle, but that's all right. It's still important. I agree. Oh, and we got semispinalis capitis. We've got semispinalis capitis. Yeah.
All right. I was gonna say suboccipitals, but let me think.
It's a tricky question, by the way.
Yeah, it is.
answer. I'm going to come back to you. I sincerely appreciate you thinking about it. Miss Monreal. Miss Monreal.
Yeah.
Madam, can you think of another muscle that attaches to the occiput, the back of your head? We've got trapezius. That was a really solid one. We've got suboccipitals. That's a really solid one. Ligamentum nuchae. And, by the way, semispinalis capitis, which is kind of the speed bumps to your neck.
Okay. Levator Scapula.
So, did you hear Miss Torres talk about the levator scapula?
No, I did not.
Oh, okay. Were you in your she shed?
No. I was trying to get all my stuff in the car because I'm actually driving now.
Okay. So what are the attachments for the? What are the attachments for Miss Torres? What are the attachments for the levator scapula?
The spine of the scapula, or the superior spine of the scapula.
Superior angle of the scapula.
Yeah.
Yeah.
And then the other one was, I forgot.
Transverse processes.
Oh, really?
Of C1 through C4. They don't go in the head, they go in the side of the neck.
Okay.
Yeah, that was what I was gonna say.
Yeah.
No, I wasn't.
All right. So can you go over the ones that you just said right now?
So review what you missed. Yeah. Yeah. But hold on, I'm going to come back to you, Miss Monreal, because somebody raised their hand. I want to see if they have an answer. Miss Nguyen. Miss Nguyen, what do you got for me?
Yeah, but how about the rectal capitis, the rectal porter in the minor?
Yeah. So did you say the rectus capitis, posterior, major, and minor?
Yeah, minor. Yeah.
Yeah, that is correct. But that is part of the suboccipital group, so it's already been said. But it is correct.
Okay.
Yeah. Good job. Let's see. We got some people back in. Miss Torres, you're coming back in for another round?
Yeah, what about the scaling? No?
No.
Are there more to the lateral?
Yeah, they're lateral. Yeah. No, these are muscles you've already learned. I'm asking you guys about muscles you learned at one time. I didn't learn. These are muscles you've heard about before, because if you learned them, you'd know this. Miss Petrie.
Did anybody say the longissimus capitis?
Well, where does the longissimus capitis attach?
To the occipital.
Does it?
I think so.
I thought it attached to the mastoid process.
Oh, okay.
Which is right next to the occipital, but it's the temporal bone.
Okay.
Yeah.
And splenius capitis was already said, right?
No, it wasn't, and that's correct. Splenius capitis is correct, Miss Petrie. Can you hear me, Miss Petrie?
Yes.
Okay. You're supposed to smile.
I thought Miss Harper said that.
I thought that was said.
Miss Harper said semispinalis capitis. You
Oh, yes, all
you
right.
said, and Miss Petrie said splenius capitis. Yes, and that is correct. Thank you. Splenius capitis kind of comes out and kind of triangulates, comes off your spine like this and goes up to your head. And it definitely grabs on the occiput. Thank you, Miss Petrie. Good job. Yeah? Okay, everybody. I think that's it from back here. You can see all that. There is a ridiculous amount of detail in this next slide, as you'll see. Don't let it overwhelm you. What they're trying to show you is all sorts of little details of each of these areas. Like if you look at the letter P, that's the external auditory meatus, which is your ear hole. Yeah? So this has bones on it. All the stuff in black is bones. This is in your book. But all the stuff in red are actually bony landmarks. Yeah? So if you look at the temporal bone alone, the temporal bone alone has a tremendous amount of bony landmarks, important stuff on it. The temporal bone alone has your external auditory meatus, which is your ear hole. It has the mastoid process, which is this bump on the back of our head, which everything, attaches to. It's got the, they should have the zygomatic process on there, I would hope. Zygomatic arch, which comes off the zygomatic process, is on there. That's part of the temporal bone as well. Temporal bone is super important, which is why we care about muscles like the longissimus and the sternocleidomastoid that attach to it. And the splenius capitis, which attaches to it, and the occiput. So, very good guess there, Miss Petrie. Boom. Some things to note that are kind of important in this picture. If we get off the head and you go down and look at this person's throat, if you look at this person's throat, the top of this throat has a bone called the hyoid bone. We have talked about it before. It is a horseshoe-shaped bone that's tiny. It's like about this size. It's going right around your throat. It's up there, you can see at the top of the throat, it's got an eye by it. It's the hyoid. When you watch detective movies, it's the bone that always gets crushed if they get strangled, because that really happens. It's easy to crush it. I don't mean that you're going to go up to somebody like this, but I mean if you're, killing people after hours, you might crush their hyoid bone. What I want you to notice about this is the hyoid bone is not the Adam's apple. The Adam's apple actually comes from your thyroid cartilage, which is below the hyoid bone. So when you see, especially on men, and it's not on all men, I'm not trying to make some statement, but men tend to have a more pronounced Adam's apple. That is their thyroid cartilage. And believe it or not, men and women actually have about the same amount of thyroid cartilage. But women have this angle with their thyroid cartilage, and men have this angle with their thyroid cartilage. We don't know why, but men have a pointier thyroid cartilage, and that's why it sticks out their throat more, and they have a more protruding Adam's apple. So that's the thyroid cartilage, which is actually below the hyoid bone. And later we're going to learn about 8 muscles that attach to the hyoid bone. Why is the hyoid bone important? Because it actually helps you talk and chew and swallow and not choke on your tongue and all that stuff. A lot of muscles attach to the hyoid bone and then attach to your mouth and your tongue and all that kind of thing. And they allow you to do all the stuff I'm doing right now, which is extremely complex. It's amazing that we use our mouths for eating and talking and breathing. So you have to have a lot of control in there. Yes, Miss Petrie.
So does that bone actually do any kind of movement as you're, does it actually elevate and depress?
Yes.
Okay.
Yeah. I mean, I don't know how much, by the way, but it elevates and depresses and protracts and retracts and stuff as these other muscles hook onto it. And then your tongue hooks down into it. It helps you kind of move all that kind of stuff. Yeah. And the 8 muscles, this isn't 100% true, but essentially the 8 muscles that attach to it, most of them have the word hyoid in it. And so we call the 4 above it, we call them the suprahyoids, and the 4 below we call the infrahyoids. And you'll often see me do this. I'll be like, suprahyoids, because they actually all live up here above, 4 of them. Infra, because they all live right down here. Suprahyoids, infrahyoids. It's just a good way, because I'm not going to memorize all 8 hyoid muscles. They've got really long name stuff, but suprahyoids are here. In fact, the bottom of your mouth, when you push on it, and it's kind of firm there, but it's still spongy, that's a hyoid muscle. That's the myohyoid muscle making the bottom of your mouth here. Anyway, you got 4 suprahyoids, 4 infrahyoids. And we'll get to that hook to that bone. Okay. By the way, just to let you know, this is us looking at the bottom of a skull. Boom. Boom. Yeah. What do we call that giant hole in the bottom of your skull? Yes, Ms. Monreal.
Does it start with an A?
An A?
Yeah.
Well, we call holes in your, no.
Well, a foramen, but...
Foramen, yes.
Okay, but is there like another word before the foramen?
No, there's a word after the foramen.
Oh.
Because this thing is a
that
really...
That start with an A.
This thing is a really big hole.
But does the second word start with an A?
No. And it
Okay.
doesn't start with a B either, or a C or a D.
Okay.
Or an E or an F. Or an H.
Well,
or an I.
as
JK.
long as we know it's okay. Just it's a foramen, okay?
But it starts with an M.
Okay, mandibular foramen. I don't know.
Foramen.
Like a mega big hole.
Yeah. You don't want to get shot. You don't want to get shot by a 44.
Oh, Magnum Foramen.
Yeah, foramen magnum.
Oh, okay, that way. If you want to say it like that.
That's just the way the book said it.
People say
You
it the
can
other
say
way.
that's absolutely Miss Morel. For you, we will say it the other way. Magnum foramen. And it just means really big hole because it's one of the largest foramens in your bodies. What is that hole for? Is that to make sure water doesn't collect in my head? Anybody? I mean, that's a big hole.
Does yeah.
Thank you, Miss Moore. Excellent answer. Yes, I mean, I know that's kind of obvious, but it's for your brain is up here. It's for your spinal cord to come down through. All that wiring, it's at its thickest right here, right? All the wires from your entire body. Your little toe that has probably 75,000 wires coming from it. I'm not exaggerating. Probably 75,000 wires coming just from your little toe. Come up through this hole. They all do. This is how you connect with the rest of the world, right? Very cool. Good job. All right. Good stuff to see and hear. I think that's about it. Yeah. Okay.